For the next sign of pregnancy, which we'll be discussing this evening, is the Linea Nigra. So Linea Nigra is kind of like linea is a line, okay? Nigra, Africans are called Negroes because their colors is dark, okay? So Linea Nigra, we're just saying there's a dark line that usually extends from the pubic symphysis to the xiphysis sternum in pregnancy. So let's discuss it. So first of all, it's a visible sign of pregnancy. It's a sign that you can see with your eyes and get to appreciate. Okay, so Latin, Linea Nigra just simply means what? Negro, Africans, linear line. Okay, so black line. It's a dark vertical line, appears on the abdomen during pregnancy. Now to talk about what the landmarks is from the pubic symphysis right up to the xiphysis sternum. Okay, as a medical student, they will always like you to describe it like that. So it typically runs from the pubic bone, that's the pubic symphysis, to the belly button. Some cases. Now see, when describing this, some Linea Nigra, they actually stop at the what? Umbilicus. Okay, most of them pass through. So you should always, if I examine a patient, you're open to actually see where it stops at. So this line is always present as a linear alba, but it becomes darker, do you understand, in pregnant women because a whole lot of what? Increase in the levels of what? Estrogen. And your melanocytes, that's your hormones that produce a whole lot of your cells that produce what? Melanin. Okay, they are now working more. Okay, so when does it appear? Mostly visible in the second trimester. So after 20 weeks is when you usually have this. So if a woman is presenting to the clinic, already has this, and you are seeing that she's just 15 weeks old, it can help you to be able to dictate an issue. Do you understand? So it usually darkens further as the pregnancy progresses. It's more noticeable in individuals with darker skin tones due to higher baseline melanin level. So is it a reliable pregnancy sign? It's actually a secondary sign. Do you understand? It's a secondary stuff. So it's not exclusive to pregnancy, but mostly in pregnancy. Do you understand? But we're just trying to say this, that if you see the Linea Nigra, do other tests to also confirm it. Okay? So that was what the Linea Nigra simply is in pregnancy.